Hey everyone, welcome back to another podcast sponsored by the National Council on Interpreting in Healthcare and put out by the Standards and Training Committee, which I chair. I'm Eliana Lobo, and this is Interpreting in Healthcare. Today, we have someone with such a wide knowledge base from legal to health to education to organization, professionalization. I'm really excited about our guest, who is Holly Silvestri. She's got so much experience in the field of both translator and interpreter training. She also runs her own language service provider agency and freelances for other agencies and government entities. Currently, she works as a senior coordinator for translation, training, and curriculum at the National Center for Interpretation at the University of Arizona. Her working languages are Spanish, French, and English. She is a founding member of American Association of Interpreters and Translators in Education. AAITE is what I call it, as well as a chair of the Public Relations Committee for the stakeholders advocating for fair and ethical AI in interpreting, the Safe AI Task Force. And I've got to take a few minutes when we get into this conversation to thank you for the fabulous job you've been doing there, Holly. Holly's also a member of the American Translators Association and her state's professional association, the Arizona Translators and Interpreters Organization, and regularly presents on various topics relevant to the professions for these organizations and others around the United States. But correct me if I'm wrong, Holly, you are an attorney also, are you not?
Yeah. Well, one of my
Welcome.
pasts.
What a wealth of knowledge. I always wish I had an attorney present to be able to bolster my arguments. Yes, that's illegal what you're doing right now.
Yes, please stop. You're doing things that will put you in jail. Right. That is my joy. I can say that with confidence.
Well, yes. So where do we get started? Because there's just such a wealth of ground that we could cover. All of us wish we had the pocket attorney at many instances in our interpreting life. Um, How did you get into this? Looking back,
Oh,
what drove all of this professional and academic achievement to
mm,
end up where you are now?
okay. I am, I guess, a serial dilettante, or I have ADHD professionally. I love learning about new stuff. So I've been through several iterations of now this is me. That was me before, but now this is me. Um, I started actually teaching because the classic immigrant, right? Your parents tell you get a safe job, get a secure government job. It's never going to go away. And I got pulled out because I was the Spanish and French teacher a lot for doing IEPs because they couldn't find an interpreter or whatever, or they didn't even know they needed a professional interpreter. The school would just be like, "Who speaks Spanish?" Be like, "Well, that's me because that's in my title." So I got started pretty much interpreting that way. I did have some experience when I was actually being a lawyer, but it was very limited. And it was weird because I was a lawyer for most of my legal career in France for an American company. And so I looked at it on the other side, right? I knew that we needed language access for all the executives in the room that didn't speak French, but I did because I had a bilingual degree. Um, so it intersected in a lot of different ways in my career. Um, and then I also knew I love cooking. And that was one of my iterations. I had a catering company. And I knew that, contrary to most people believing that you need to know French to work in a restaurant, I was like, yeah, no, you need to know Spanish. Because that's the entire back kitchen, people. Okay. I don't care what the waiter speaks. The guy who's making your food, he speaks Spanish and he's probably from Guatemala. Okay. So languages have intersected in my life in so many weird ways. And then after my iteration of teaching, I got teacher burnout and I was like, okay, well, what am I going to do now? And I said, well, I'm constantly being pulled out of these classroom to be doing either training about bilingualism or language access, or I'm actually being pulled into these meetings with parents. Why don't I kind of get some training on this? Because I think I'm going to probably end up doing more and more of that. So I ended up getting some training and I was like, oh, okay, why not? But we all, as immigrants, have experience with this, right? It's the classic story. I was young, the eldest of two, however, and my parents relied upon me to be the interpreter, right? The child interpreter, because even though they were educated, they didn't understand language access in this country. They didn't understand the rights they had. And typical immigrants, right? They wanted to keep it in the family. There was a shame element, right, to not knowing. And so you're just going to talk to the bank guy. Okay, well, I knew a lot more, right? The parentification of your first child or your second child or whichever child is doing that. We talk about that a lot, right? When we do some training, right? Please don't do that to your children. I think the only thing that really hit me, though, I didn't, because I was so much older than my sister. It didn't really hit me that I was being put in a place that I didn't want to be until my mom got the cancer diagnosis through me. That was really not pleasant. And I was old enough at that point to digest that this was like, what the hell is going on here? This isn't right. Right.
Yes.
So those experiences,
as far as I'm concerned, having lived through something similar myself, being
right.
the messenger of a poor prognosis or that scary word cancer when you're a child is just child abuse.
Well, it's terrifying in and of itself, right? If it's for you, but you have to put yourself in the eyes of the child, like, oh my God, right? This is way when, cancer was the big C and everyone was terrified of it. And, I'm old. Okay, let's be real. So the big C was a big problem. That basically equals death, right? In everybody's mind. And kids were also programmed with that information, right? And so the first thought was like, oh my God, I'm going to lose my mother. That's like, and of course I didn't have the words for melanoma. Who uses those words in their daily conversation? So at the same time, I was struggling to figure out how I'm going to communicate this message. All I saw was, oh my God, I'm going to lose my mother, right? What now? And how do I tell my father? Because I went to the gynecologist with her because I was the girl.
I've seen
So
children, people in their 20s and 30s who are present to accompany their parent break down and have to.
Oh, of course.
When that diagnosis is shared. So
right.
why do they think it's okay for an 8-year-old or an 11-year-old?
No, I know. And I understand the instinct on both sides, right? This is better than nothing. It's the same family. What's the problem with it? They don't see the side of like, hello, it's a child. It's access. It's through language, right? On the English speaker side and on the LAP side, I understand also the instinct to let's keep it in the family. Let's tamp down the shame. Let's make sure that we can fix this because we're the problem, right? It's our issue. And I'm like, and that too bothers the bejesus out of me, right? People don't view it as a shared problem. It's not the English speaker's problem.
It's all on them.
Right? It's all on the LAP. We wouldn't be there we wouldn't need an interpreter if it weren't for you. I'm like, excuse me.
Just learn to be fluent in 2 months.
Right. Oh, I see. Your grade school Spanish is going to be able to communicate with her if I'm not here. That's the issue. Okay. It just irritates me that, and I know that it irritates a lot of people, but it is always fresh in my mind that and the phrase, I'm just the interpreter. Please, can we eliminate that from our discussions? Please, can we stop doing that to ourselves? I think are the two key factors for me. Like if I train anybody, those are the two things that I pound like into them. Like, please don't say that ever, 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 even with your friends, even if you're drunk, stop it. Just stop it. And please don't blame the LAP. It's two-way communication.
Your experience in always being pulled out for these IEPs actually led to your creating an
Oh, yes. And that is
national
that.
organization for interpreters in education, which is an area that has been very slow to come on board in
Yeah,
comparison to healthcare, which was slower than the courts. But we're getting there.
right. We're
Getting
getting there. And those are the three that I consider the trifecta. That clearly it should be everywhere. Language access should be a human right. But where we're talking about are three places where a miscommunication or a mistranslation can change someone's life dramatically. And people didn't realize it. They saw that need right away in the courts, right? Thank God. Although it's not perfect, it's still a work in progress. And they eventually saw that need in the medical field, which was like, duh. But they didn't see it in education. And as someone who had experienced the need for, I did my own parent-teacher conferences because I was like, I am very intelligent. I got an A, because, the teacher talking to my mother was useless. And I saw that was, a 16-year-old in charge of doing that for themselves. If I were, the evil child, hell, I would not be accurate in any way, shape, or form. And so that could dramatically change the aspect of the parent-teacher conference and the communication with the parents, which I think is super important, at least in our system, right? In the US system. I get that there are other systems that kind of outsource that to the teaching faculty. So yeah, I mean, and that was the beginning of me going, well, where do I go to get trained about this particular niche of specialization? Who is the expert? And I was like, I guess it's me. Let's start an organization. And I found like-minded people, and we did. So
I love that, as opposed to wringing your hands. Oh, there's nothing out there. Well,
there's nothing out there. Well,
make
I'm
it
creative.
ourselves. Yeah.
Right. I've always been of the ilk, everybody's waiting around for the prince. And I'm like, hey, Cinderella, save yourself. Got news for you. He ain't coming. And even if he is, he's likely late and old and bald. So get on board.
I love it. So looking around at the current landscape of the now, what's got you revved up, good, bad, or in between?
I'm all about AI right now. And I know that that's because I'm on the committee, or that's one of the reasons that I'm on the committee I'm on and I'm involved. But even beforehand, when this first came out, I was like, oh, this is going to be a huge disruption. What about our profession? I liken it to the wireless revolution.
Yep.
Phones, landlines, and they just announced, ironically, 2 days ago on the local channel, and I've yet to check the source, but I trust them for what it's worth these days, that now in the United States, not worldwide, but in the United States, there are more cell phones than there are landlines.
Yeah.
We've tipped it over.
I saw that.
So I think we're not there yet with AI. We're at the very beginning where it was, you had the brick cell phone. Now you have basically a computer in a tiny little, this foldable phone.
And I see it with the possibility of that little snowball that starts rolling from the top of the mountain, and
then it obliterates the village at the bottom. Right? Like someone throws a snowball at the top, and it's like, oh, I'm sorry, I destroyed your village. Yeah, it's that.
Share with our listeners that you've been doing an incredible job, because before you arrived and since you arrived is night and day in terms of our presence and the number of messages and the outreach and the postings and the information. It's really incredible that just one person is generating all of that output. So thank you
Some
so
people
much.
don't sleep much, I know. No, I mean, thank you. That's very kind of you to say, but it's also just a question of, okay, this is something that interests me and I enjoy doing it. But also I'm not going to take all the credit away from the people that were doing it before me. I mean, it's a very small admin group. That's what a lot of people in our profession don't understand is all of these volunteer organizations are being run by volunteers, and it's usually about 5 people. You remember in school where you had that partner project for like 4 of you and one person did all the work? That's the admin group. And everybody else got the A, but the admin group is exhausted because they spent all night getting that A for everybody. I mean, it's similar, right? So clearly you just needed more bodies, and I'm just an extra body in some sense too. I mean, yes, I work hard, but it's just a question of like, there's enough work to go around.
In addition to being all volunteer with people that have full-time jobs and whatever else is going on in their lives, it's a lot of interpreters and translators. So it's a lot of people who want to say something.
We're a big talking group.
People who also don't have that much time available. It's not that easy to get consensus, but everybody wants to be heard. So kudos. So looking at the current landscape, what would you like to see happen that could help leverage this work?
I'd really like us to get to the point where we can have the discussions that we desperately need to have with the developers of tech, right? The interpreters and the end users should be involved in this creation from the beginning. I'm not sure how we can make it happen, but it is my sincerest hope that because of Safe AI, that somebody out there will listen to us and bring us into the boardroom and let us have a conversation with them about, look, yes, I get it. Some of us are sincerely afraid for our jobs, and in some ways, they're right to be. At the same time, we understand that this is a tremendous opportunity for language access. If you just work with us on getting it right the first time and not having to patchwork it at the end because you forgot to talk to us in the development stage, and we then end up looking awful because we end up nitpicking and criticizing you because you never talked to us in the beginning about how to make this stuff.
I'm so tired of being called to the table when they announce the rollout of something that they never thought about language access.
Right.
So when you ask the question, it almost seems like you're raining on the parade. Like, well,
right. It's this fabulous new app. How many languages is it in? Oh, that? No, we haven't thought about that yet. That's an add-on.
But if they would be willing to have us help them find where's the edge of the cliff in this scenario, where's the edge of the cliff in this context, we would be so thrilled to be able to contribute to advancing the technology, because
absolutely
everyone benefits if it's done in a safe way.
So if you're out there, I'll bring the bagels. Just let me in the meeting.
I don't want to pay for it with, what do they say? The negative outcome, right? Which is the linguistically appropriate way to say when somebody dies or somebody acquires an infection in the hospital that they didn't arrive with, bad outcomes for the hospital. Negative outcomes, we could minimize the number of those if we were,
and the number of readmittances and all of those things that drive up costs. This is a cost-saving measure if it's done right. And it could benefit society in general if it's done right and expands language access properly with the guardrails in place so that it's safe and ethical. That's all we're asking. We're not saying eliminate AI. That's not our name. Right?
You can't develop a technology like this and only pour English through the large language models.
I know. So, or, there are other issues with that, right? That haven't been resolved yet, right? The copyright issues and the data that's needed, and the fact that whether we like it or not, the vast majority of the internet, where they're drawing supposedly this free, we'll talk about whether it's free or not, data is the internet that is English majoritarily. And then, I wrote in the article I wrote for the technology division. If it's not English data, a lot of the science says it's poorly MT translated from English into another language data. So garbage in, garbage out, right? Your LLMs that are based on non-native texts, but poorly MT translated texts for that language, doesn't sound like it's going to create really good stuff to me. I don't know, but maybe I'm wrong.
So I think you're right on the money on that one. So looking forward then, given the situation that we're currently in, and we can see what the possibilities are, and we're all too aware of where the holes in the bridge are that
Right.
fall through. What would you like to see beyond partnerships with tech? What can we do? Do we need more grassroots? Do we need training
I
on
think we
how
need all of that. I think we definitely need
legislation
all of that.
happen? Like,
Mhm.
what's missing? Because I feel like something's missing and I want to learn how to do it and then help other people learn how to do it.
Well, I think the key element is, and this has been a problem not only in our industry, because like I said, I have ADHD professionally, so I've had other professions. Everybody expects the professional organization to fix the problems in the profession. I'm sorry, but this is a crisis like a fire. If you expect just the fireman to save your house and you're not going to pick up the hose and put some water on something, the outcome is going to be less than desirable. And to use our terminology, everybody's accountable in those situations. And this is one of those situations, right? If you're going to sit back and wait for ATA or Safe AI Task Force to save you, what did I say before? Cinderella, save yourself. The prince is off with someone else. Figure it out and be part of the solution, not just a complainer about the problem.
Yep. Because yes, there's that saying, the rising tide lifts all boats, but can you bail with us?
Right. Yes. Please pick up a bucket. Anybody? I'm just asking for bucket people, right? We need a bucket people. Here I am out here, Popeye, trying to get the boat off the ground of the.
We're laughing here, but this is serious, folks. Whoever's listened this far, jump in the pool. There's people waiting to help support you, but don't just wish things were different. Try and do something with us to make things change.
Absolutely. In your small part of the world, nobody's asking you to save the Israeli hostages, right? This isn't world science, right? Or geopolitics. How about you just work with your state organization so that everybody's aware of what we're doing and you guys have a subcommittee that helps us in your state? That's start small. Or, Perfect. Your hospital, even smaller. I'll take a tidbit, right? If I can get it. Right. And everybody, that's how everybody who is a big name, by the way, in this industry started. They dipped their toe in and now they're scuba diving. Right. That's the only way to get in the water. Dip and then gets progressively deeper.
So we're inviting you, dip your toe in.
That's right.
Jump in.
And by the way, it's absolutely refreshing.
The association that AAITE for Interpreters and Translators in Education. Join the National Council on Interpreting in Healthcare. Join your Association of Judicial Interpreters and work towards what you want to see. It's that 1 hour a month at that meeting with like-minded people that helps put out information and bring other people into more and better understanding that makes things happen. If we just sit around and complain, nothing's going to change. And okay, as a final closing word, I'm always reminded by something my grandfather said to me. We were at my grandmother's funeral. I was like, at that point, 7 or 8. And of course, he was devastated. But there were so many people at that funeral. And I was astonished. And I was like, Grandpa, why are there so many people here? And he said, because she cared enough to help people. Remember this for your future. Nobody's showing up at your funeral because you were really great professionally. Nobody's showing up because you made a lot of money. They're showing up because you gave something back
to the community you lived in. And that, I think, is the best advice I ever got.
That is hearts. That's the best advice. And I'm going to end us on that note because I can't make that any better. Thank you so much for joining me today, Holly.
No
Thank you
worries.
all of you who listened in, and stay tuned for the next episode of our podcast, Interpreting in Healthcare, brought to you by the National Council on Interpreting in Healthcare. Até logo. Ciao, ciao.
Bye-bye, guys.